have Ms. Knick, the English teacher?
Yep.
Her mother. Awesome. Okay.
Alrighty. Sorry for those of you who had my mom. I'm told we sound very similarly and act similarly. So here you go, part 2. So my name is Dr. Elizabeth Knick. Like she said, I graduated from Franklin County High School back in 2011. So I sat in the seats you guys sat in. I went through the classes you guys went through, and I was able to go to vet school and become a veterinarian. And then I came back to my hometown to practice. I work at Franklin County Animal Hospital, just right up the road on 220. If any of you guys are familiar with that place. And I've been there for about a little over 4 years now since I've been out of vet school. So what I'm going to talk to you guys today, sort of the plan is we'll start with, how do you get into vet school? What does it take to get into vet school? How do you even become a veterinarian to begin with? Then we'll sort of talk about what vet school is like, and then we'll sort of talk about day-to-day life as a veterinarian. What do I do? What is my actual job? And then I have some cool x-rays and things I'll show you guys at the end, just some examples of some very weird stuff that I've seen over the past 4 years in practice, because it definitely is an interesting job and every day is different. So like I said, we'll start with how do you get into vet school? How do you even become a veterinarian? And we'll kind of start with where you guys are now. So you guys are seniors in high school. You're about to graduate in the spring. You're thinking of those next steps that you want to take. So really, what you do in high school, there's not a ton you can do in high school to prepare for vet school, especially at this point. But things that are really good to do, especially this corner over here that keeps talking to each other. Yeah, I guess you're not interested whatsoever. Thank you. So what does it take to become a veterinarian? You're a senior in high school, things you could do right now, volunteering at a veterinary clinic or an animal shelter, things like that would be great first steps. Get your foot in the door, meet a veterinarian, get associated with a veterinarian, kind of get those hours in, see if it's even something you're interested in. Because a lot of people have this grand idea in their mind that, it's great, you get to play with dogs and cats all day, and as you'll see later, that's not the truth. So things you can do right now would be getting into a vet clinic somewhere, volunteering, or even getting paid for it, because that's going to become important later when you apply to veterinary school. So once you graduate from high school, you go to college. You could go to college anywhere you want to study pre-vet. It doesn't matter. It's not a specific school that you have to go to. One school is not going to give you an advantage over the other. I went to Virginia Tech for undergrad. I did 4 years Virginia Tech Animal and Poultry Sciences because that's what I wanted to do, but you don't have to do that. You could start out at Virginia Western at the CCAP program, start at any college you want to. The big thing is you just have to take certain prerequisites to get into vet school. So math and science are going to be your best friends. If you want to get into vet school, you have to take a lot of math and science prerequisite courses. Things like biology, chemistry, organic chemistry, statistics, calculus. Those are all prerequisites that every vet school is going to require no matter where you apply, and it doesn't matter where you take that course. The biology course I took at Virginia Tech would be the same thing you could take at Virginia Western. So the big point is it doesn't matter where you go. What matters, though, is what grade you get in that biology, chemistry, whatnot class. Vet school is very, very competitive. I'll talk a lot about Virginia Tech just because that's where I went, that's where I'm most familiar with. For example, this year specifically, the Virginia Tech Vet School, they have 20,000 students applying for 120 spots. You have less than 10% chance of getting into vet school. So what becomes important are your grades. Your grades are going to be very, very important. That GPA is one of the first things they're going to look at when they're looking at your application. Really, to be competitive to getting into vet school, you need to average about a 3.5 GPA in college. This is not in high school. What you did in high school, they're not going to look at that. In college, you need to average about a 3.5 GPA or better. There's always exceptions to every rule. We'll talk a little bit about that here in a minute, but really your grades are very, very important. So you need to take that very seriously, especially in those math and science courses that they're looking at as prerequisites. Vet schools also have prerequisites. A lot of them you have to take an English class. You have to take a psychology class because there's a lot of dealing with the public and the emotions of their animals being sick, so you have to take a psychology class. So in all of those things are prerequisites that every vet school in the nation is going to require, regardless of where you go to undergrad. You could also major in whatever you want to in undergrad. Like I said, I was animal science, but you don't have to do that. A lot of people do biology. There was one girl in my class in vet school, she majored in nuclear physics and ended up going to vet school. So as long as you take those prerequisite courses that they require, it doesn't matter. You can major in whatever you want to. So that's the first big thing about getting into vet school is your grades. Grades are super, super important. But they also look at other things too, because they realize not everyone is the best academically, not everyone is a great test taker, but you still have certain aspects that are going to make you a good veterinarian. So another thing that is required for getting into vet school is you have to have about 500 hours working in a veterinary clinic, whether that's volunteer hours, whether you're getting paid for it, large animal, small animal, zoo animal, reptiles, they don't really care. They just want to see that you've put time and effort into the veterinary field and that you've really thought about your decision before you apply to vet school. Because like I'll tell you, it's not an easy job. It's not something to take for granted. There's a lot of people applying for a few amount of spots. It's also not cheap either. We'll kind of go into the cost of veterinary school a little bit either, but you want to make sure you know what you're getting into before you spend all that time and all that money. So they want you to have about 500 hours in the veterinary field. Like I said, paid, unpaid, it doesn't matter. I did a lot of volunteer work at local clinics and actually worked in a vet's office every summer throughout college is how I kind of got my hours. The third component of applying to vet school, so you have to have good grades, you have to have those hours working in a veterinary clinic, and then you have to have some recommendation letters. You have to have 3 recommendation letters. One of them has to be from a veterinarian. So that's why I say now you could start building those relationships with the local veterinarian so that way they know you and they know your intentions when you're applying to vet school, because you have to have a recommendation letter from a veterinarian. The other 2 recommendation letters could be from anybody you want to. So maybe you have a teacher here in high school that you get along with really well, a teacher in college, anything like that. But you have to have 3 recommendation letters as well. You also have to write an essay to get into vet school. So your English classes are very important. I was lucky, my mom is an English teacher, she read mine. So, maintain those relationships with those English teachers because you have to write, I think it's like a 3-page essay or something like that. I don't remember, it's been a while ago now, but you have to write an essay as well. So let's say you go through all those steps, you have great grades, you spent a lot of time in the veterinary clinics, you've got your recommendation letters, you wrote a great essay, you apply to vet school, and they like your application. That's not it. After they look at your application, if they decide they like your application, you also have to interview to get into veterinary school. So that's the second stage of the process, is you go through an interview. They've changed the interview process a lot since I was in vet school. When I was in vet school, you actually went to each college. I applied to 5 different schools and I had to travel to each one, and I had to sit down face-to-face interview with the professors. They don't do that anymore because of COVID. Now it's all online through Zoom and things like that, I think. So they have changed that a little bit, but it's the same principle. You go through an interview, you talk to the professors, they're looking for certain character traits, and then based on that off that interview, they accept who gets in. So kind of the way it works is, I told you a little bit, there's a ton of people that apply to vet school. You've got, they told me the number for this year at Virginia Tech is about 20,000. So you've got 20,000 people applying for 120 spots. So they take that 20,000 and they narrow it down from the application and they interview about 400 students. So you're going from 20,000 down to 400. So they're making that big cut. And then once they interview from those interviews, then they pick that final 120. So it is quite the process. It's definitely not something to take lightly. It's definitely very challenging. But I say all that not to be scary, but just to let you know what you're getting into, that you got to take it seriously. But I stand here as proof it is possible. You know, someone from Franklin County who sat in your seats went through that process and did all that and was able to become successful. So while the numbers are scary, and I sat there and I listened to vets tell me the same thing, you got a less than 10% chance. It is definitely possible to do. So are there any questions just off that about getting into vet school from anybody before I move to the next stage? Because I know that's kind of a lot that I threw really quickly. Just on getting into vet school. We'll go through more stuff here in a second. If not, that's fine. Alrighty, so you go through that whole process and you get into vet school. So let's kind of talk a little bit about what vet school itself is like, because it's really very different from anything you've experienced. Vet school is a 4-year program. It's a 4-year doctorate degree. So you'll go through 4 years of college, you'll get your undergraduate degree, then you go through another 4 years of veterinary school and you graduate with a doctorate. So I have a doctor of veterinary medicine. It's the same as doctor of human medicine, anything like that, you graduate with your doctorate. But because of that, it's a 4-year, very intensive program. So vet school itself, you're in class most days from 8 to 5. It's like working an 8 to 5 job. You go in 8 o'clock in the morning. Typically you'll sit through 4 hours of lecture from like 8 to 12. They'll give you like a 10-minute break in between classes. So you'll go listen to lecture that morning. You get an hour for lunch, and then you're back in the classroom sometimes in the afternoon from like 1 to 5. Or you're in the laboratory kind of learning things on animals and things like that. So it's like a job. It's from 8 to 5, and then you go home at 5 o'clock, and they expect you to go home and study what they taught you that day. So on Monday, you need to know on Tuesday what you learned the day before, because they're going to keep moving, and if you don't go home and study that material, you're going to fall behind really, really fast. So it's very intensive. It's a lot of work, but it's also, for me, it was a lot of fun too, because you are learning about animals. You're becoming that veterinarian that you wanted to be. So the first 2 years of vet school, you're pretty much just in the classroom. From 8 to 5, you're learning the basics of animals. You're learning anatomy, physiology, biology, just sort of the set of all animals. You learn dogs, cats, horses, cows, pigs, goats, sheep. Your first year of vet school, they'll have you in the anatomy lab a lot of times in the afternoon doing dissections on dead animals to learn all the muscles and nerves and blood vessels, and you have to do it on dogs, cats, cows, sheep, pigs, chickens, because every veterinarian is licensed to treat any animal. You all have to take the same boards at the end of it, so you kind of have to know the basics of every species. So that's a lot of what you're learning that first 2 years. Then as you get into your 3rd and 4th year, you can kind of specialize a little bit more. So for me personally, like I told you guys at the beginning, I only practice small animal medicine. So on my day-to-day basis, I only treat dogs and cats, and that was my choice. That's what I wanted to do. That's what I was interested in. So they have that option. Your last 2 years of vet school, you can track or specialize in what species you want. So whether that's small animals like dogs and cats, they have equine tract where you're just doing horses. They have large animal where you're doing the cattle, sheep, goats, pigs, kind of the livestock. And then they have another tract that a lot of people don't think about. It's called public corporate. So veterinarians work in all aspects of animals, not necessarily just treating your dogs and cats and cows and everything like that. There are veterinarians that work for the government, veterinarians that work for the CDC making vaccines. There's veterinarians that inspect the meat that you guys eat before it goes to the grocery store, veterinarians that are tracking imports in and out of the country. There's veterinarians that are in the military taking care of the military dogs and if they still have horses and things like that. So being a veterinarian, you're not necessarily working with animals all the time if you don't want to. There's lots of different avenues to explore, different opportunities. I had several in my class that joined the military after graduation, and they work in the military and they get all those benefits. So they have that public corporate track because there's a bunch of different things you can do with veterinary medicine. So those last 2 years, you're kind of focused more on your tract. You're getting to work with animals a little bit more, actually doing procedures on animals. Your 3rd year of vet school is when you do your first spay and neuter. So that's the first time you ever do surgery on a dog or cat, is that 3rd year of vet school. So that's always really exciting. And then your 4th year of vet school, it's basically like an internship or a residency if you were in the human field. You're in the clinic. So up at Virginia Tech, they have that teaching hospital. The students are in the clinic, seeing the patients, taking history, working with the clinicians, trying to find those diagnosing communication skills that are required to be a veterinarian. So it's basically like, being a medical resident, if any of you have ever watched those kind of TV shows or things. And you rotate through a bunch of different specialties: surgery, internal medicine, neurology, oncology, cardiology. So you kind of get a good basis, both large and small animal, of diagnosing, treating, and actually working up cases that last year of vet school, which is a lot of fun, but it's also very intensive. I know that I mentioned those first few years you're in class from 8 to 5. That last year of vet school, we're in the clinic, you're pulling 12-hour plus days, to be honest with you. A lot of times we were required to be there at 7 o'clock in the morning. We would get out of there at about 7 o'clock in the evening, and sometimes you would be on call, and if an emergency came in, you would come in. I had terrible luck when I was in vet school. I got called in pretty much every time I was on call. I've been there at 2 in the morning, you know, watching them do surgeries on Saturdays, on Sundays. There was one time, my last year of vet school, it was around Thanksgiving, I was on the surgery rotation. It started snowing that morning because it was Blacksburg, and it was coming down hard. It probably snowed like a foot of snow, and my professor called me and said, hey, we got this dog that ate a Christmas ornament. We got to go to surgery and get the wire out from the Christmas ornament. And I was like, oh, okay, like, you know, that's great. I was like, it's going to take me a little while to get there because my apartment was snowed in. They hadn't plowed the parking lot or anything like that. Technically, when they call, you're supposed to be there within 20 minutes. And he was like, oh yeah, I forgot it was snowing outside. He was like, you'll still be here, right? There was no like, oh, it's okay if you can't make it, like we'll help you out. It was, you're still going to be here. You don't get a pass because it's snowing. This animal needs us. We have to go now. So it was actually kind of crazy. I was able to make it to the school because I drove a Jeep. I had 4-wheel drive. It was a little dicey, but I made it. I got to the school and got to like the ICU where they have all the animals, and there was a professor. He was calling students who were supposed to be on ICU duty that night, and he said, hey, can you get here? And if they would say, no, we can't get here, he goes, okay, that's okay, I'll come get you. Where do you live? So he was getting the students from their apartment and bringing them in. So just to show you, there was no free pass in vet school. They don't care if it's snowing, if you're sick, whatever. They expect you to be there because the animals need you and lives depend on it. So just kind of a funny story. I thought it was, you know, funny. You could hear the students' disappointment on the phone, and they were like, oh, you're going to come get me? Because like they were like, oh, I get the night off, but they did not. So, you know, not that that happens all the time. It was that was the only time it happened to me. But just kind of an example of how different that is compared to here. If it snows 5 flakes, y'all get out of school for the day. So just a little bit kind of different, something to think about before you go into it. Sorry. But anyways, that's a little bit about vet school itself, the classes, things like that. Another question I often get asked by you guys is, how expensive is vet school? Because you're making this 4-year commitment. You went through 4 years of undergrad. You may have loans from undergrad and things like that. So vet school itself, it's not cheap either. When I was in vet school, it was about $45,000 to $50,000 a year. So you're looking at about $200,000 or so just for tuition for the 4 years of vet school that you're in there. You got to think about room and board, textbooks, supplies, food, things like that that you need. There's definitely scholarships that can help out with that, you know, things like that. But most veterinarians, if you go to your in-state school, come out of school with an average $250,000 to $300,000 worth of student loan debt, which is going to take you a while to pay off. So, you know, thinking about that number before you go into it, knowing you're going to come out of school with student loans that are going to take you about 10 to 15 years to pay off, definitely weigh that as well, take that into consideration. If you go to an out-of-state veterinary school, for example, you live in Virginia but you go to the University of Tennessee or something like that, it's going to be more expensive because it's out-of-state. You're going to come out with a little bit more debt. So there's things that play into that. You know, there's always assistance programs and things like that, but just on average, it's not a quick, easy venture, and it's not very cheap either. So kind of some things to think about with that, just give you an idea of how different it is. Mm-hmm.
Do you guys remember how much they make when you looked it up yesterday? $100,000. It is a huge number that she's talking about, but
yeah,
it is doable.
Yeah, it is doable. Yeah, and you know, how much you make too depends on the area. I will say an area like this, you're making a little bit less than an area like, you know, Richmond, places like that. But, you know, it's definitely doable. For me, it's been doable. For me, I don't regret the debt that I have whatsoever because I love my job. I wouldn't want to do anything else. But for some people, that, you know, it's hard and there's things to think about because, you know, you hear $100,000 a year, but you're losing some of that in taxes. You got to pay rent. You got to pay groceries. Do you have a family? You know, so all those things kind of add up too. As well. I'm not trying to scare anybody off from it, just think about all the logistics of it, because I mean, it sounds great to make $100,000 in salary, but then once you really see it, it's like, well, you know. But does anybody have any questions about vet school itself, the process of getting into vet school, anything like that before I go to the next stage of it? Because I know that's a lot, and it's a lot. But is anybody interested in vet school? Just out of curiosity. It's fine if you're not. Yeah. Or vet tech, yeah. Anything veterinary related. It's fine if you're not. It's not for everybody.
Guys, I know a couple of you were interested. It's okay.
It's fine. I'm not going to call you out or anything. I don't care. I'm just curious to know if I'm talking to, anybody who might be interested.
Do you have to do like calculus and all that?
Yep, you have to do calculus. Unfortunately, you do. Have to do calculus, have to do biology, have to do chemistry. So those are the ones that get you sometimes. Sorry. Alrighty, well, if nobody has any further questions about, and if you think of one later, you can still ask it later, about getting into vet school or anything like that, I'll now kind of talk about what does it mean to be a veterinarian? What do I do? What is my day-to-day like? Sort of what goes into that. So as I mentioned at the beginning, I work in small animal private practice. So I'm going to talk from my experience as a small animal veterinarian. It's a little bit different if you work large animal or things like that. So I work, like I said, at Franklin County Animal Hospital. I only see dogs and cats. I work 4 days a week, 4 10-hour days is my schedule. I work from 8 to 6. And I see just general wellness things. I'm kind of like a primary care physician. If you got sick, you would call your doctor. You would go to your doctor. That's kind of, me. So if your dog and cat gets sick, I'm the first one you're gonna call. So I see a lot of just wellness vaccines. You got a new puppy, it needs its shots, we do that. You have a 5-year-old dog, it's due for its shots, we do that. But then we also see, mild sick things. If your dog has an ear infection, if your dog has allergies, if your dog might have a urinary tract infection, if your dog, has something wrong with its eye, we're the ones you're gonna call first and try to figure out what's going on. We also see emergencies during the hours that we're open. We see a lot of hit by cars in Franklin County because there's no leash laws. We see a lot of dog fights, dog attacks, things like that. So a lot of trouble breathing, respiratory distress are some of the more common emergencies I deal with on a day-to-day basis. And they could walk in the door at any time that we're open during that 8 to 6. So that's kind of one of the things I love about veterinary medicine is every day is different. I go in and I have my schedule. I start seeing appointments at 8:30 and I go till about 5 o'clock in the evening. I see one appointment every 30 minutes and it's always different. Like I said, I could go from seeing a happy puppy to a dog that just got hit by a car back to something that has an ear infection. My day is different every single day I walk in the door. I also have 1 day a week that I do basic surgeries. Tuesdays just happens to be my surgery day, so I do spays, neuters, dentals, mass removals, bladder surgeries, abdominal surgeries, and I'll show you some of those on the PowerPoint when we get to that. But I do basic general surgeries as well. And so like I mentioned, we're kind of like your first stop primary care physician. So for example, if we see something that we're unable to treat, your dog has an ulcer in its eye that's really, really deep, its eye's about to rupture, there's not much we can do for that in general practice. So there are referral specialty centers like Virginia Tech where you could be a veterinary ophthalmologist, you could be a veterinary cardiologist, you could be a veterinary neurologist. So you can specialize a little bit more in veterinary medicine if you wish to, and we would send you to places like that. So there is opportunities for that in veterinary medicine. Some people work emergency clinics where they're on call. I don't do any on-call hours. I chose not to do that for my lifestyle choice. When I walk out the door at 6 o'clock, I'm done until the next day. I don't work on weekends. Wednesdays are my day off, so I get a day off during the week to do things that I need to do, and that works for me in my lifestyle. But some people, they like the emergency hours, and you can work in things like that. You also have large animal vets that will go out to people's farms, go out to people's houses, treat their goats, cats, and so it's all a different lifestyle. But for me, I'm in the office seeing patients just generally throughout the week. So a big thing about veterinary medicine that I like to emphasize to you guys too, that a lot of people don't realize, is a lot of people, like I said, have that notion in their head, oh, I'm gonna be a vet because I love dogs, I love cats, I wanna play with animals and puppies and kittens all day. And I promise you, You do get to do that some, but it is not that. A huge part of veterinary medicine is talking with people. You need to have good communication skills with your clients, with the owners, because they bring their dog in. The dog can't tell me where it hurts. It can't tell me what's wrong. It can't tell me when it started, if it's taken any medications for it itself. It needs somebody to relay that information to me. So it needs that owner. So learning to ask the right questions. And then when I prescribe a medication for that dog, it can't just pop open the cap and take it for itself. It needs an owner who's going to be there to give that medication as directed. So sometimes these medications, we want the animal to take it 3 times a day. Well, that doesn't always work with everyone's work schedule. Some people can't get home during lunch to take care of their dog. So kind of finding those alternatives. How can we make this treatment easy for you, easy for your dog, and affordable? Because a lot of people don't have pet insurance on their dogs, so it can be expensive to get the animal the help that it needs to. So learning to talk to those clients, a big part of my job is talking to people, having good communication skills, and learning what's best for the animal. Another part of my job where that client communication becomes really important is how many of you have had an older pet that's not doing well, and then the time comes that maybe a decision needs to be made where it needs to be put to sleep. And so that is a really, really hard part of the job for the owner, for the veterinarian, talking, making that decision, trying to guide when is the right time to do this, how can we do this peacefully for the animal. So client communication becomes a huge part of the job. Another huge part of the job that people don't think about being a veterinarian is writing. I actually spend a lot of time writing records. After every patient that I see, I have to go back and write what's called a SOAP. And basically it just kind of describes the visit a little bit. What was wrong with the pet? What did I do? What are the next steps if the pet doesn't get better? So that way, if they need to go to another veterinarian, or say they come in on a Wednesday when I'm off, the other vet who comes behind me knows what's going on, knows what was talked about, and knows, how sick the pet was. So we spend a lot of time writing records, so those English skills you guys are learning right now become very important as well. Communication, writing, and then sometimes you get to play with a puppy or kitten at the end of the day. But those are a large part of my job as a veterinarian, is diagnosing pets, prescribing medications, writing those records, and communicating with clients. So that's a lot of what I do on a day-to-day basis. I also like to mention to you guys, there are other opportunities in veterinary medicine. If you don't want to be a veterinarian, you don't want to go through all that schooling, pay all that money, spend all that time writing records and talking to people about their pets and things like that. There are other options in veterinary medicine that are a little less intensive. So we do have licensed veterinary technicians in veterinary medicine. They would kind of be like the nurses in human medicine. You do still have to go to veterinary technician school. I think a lot of the programs are 2 or 3 years. You can do them online, or there is an in-person place up at Blue Ridge, I think. But my veterinary technicians, what they kind of do, they're like my nurses. They're doing the blood draws, they're taking the x-rays, they're monitoring anesthesia while I'm doing surgery on these pets. They are, taking temperatures, getting histories. So they actually get to spend a lot more hands-on time with the animals than I do, because they're doing all those diagnostic procedures with them. So there is another opportunity in veterinary medicine that's not as intensive as going all through vet school. There are also opportunities to work just as veterinary assistants, veterinary receptionists, where you wouldn't have to go through all that schooling either, but you'd still get to be involved in the veterinary atmosphere, and be involved with some of the animals and things like that as well. So there's definitely opportunities to pursue where you wouldn't have to go through all of that if that was something you're interested in. Every once in a while I get somebody who's interested in being an LVT, so I like to mention that too. There's that opportunity to be a veterinary technician where you don't have to go through all that schooling and things, and spend just as much, probably more times with the animal as well. So does anybody have any questions about any of that? Like what I do day to day, kind of the things involved with my daily job?
Remember, you all have 3 questions at least.
I say, I know you guys wrote questions. Now would be the opportunity to.
We'll just go around the room.
What was your main, first thing when you, buy animals, is that why you started your job?
Oh, like why I wanted to be a vet? Yeah.
Should you just be a doctor or something?
Yeah, that's fair. So I've wanted to be a vet actually since I was a little girl. It's all I've ever wanted to do. When I graduated from vet school, my mom actually found a thing I had written in kindergarten that said I wanted to be a veterinarian. So it was pretty cool to see that come full circle. But I've always loved animals. I've always had a connection with animals. I've loved dogs and cats. My grandfather was a dairy farmer, so I grew up around animals in this area. But then I kind of realized it was an opportunity to help not just animals but people as well. And so many people today, you know, their pets are like their kids. It's a part of the family. And so it's an opportunity to not just help those animals but help people by helping those animals. So being able to work with both on a daily basis, and I love math and science. I have such a science brain. It was definitely the right fit for me. Yeah. I think, was somebody over here going to say
I
something?
also want to say, like, for allergies, if you have allergies, do you still need to do it?
Yeah, so that's a good question. So yes, you can. We actually have a girl who works at my clinic. She's allergic to cats, and so she just doesn't work with the cats. She works with just the dogs. So it is possible, I guess, depending on how severe your allergies are. You could probably get medications and things like that. But it is possible if that's something you wanted to do, because yeah, she does it every day. She's allergic to rabbits too. Every once in a while, a rabbit will come in, and she has to leave the room. So. Yeah.
Is a travel vet, like you do the same schooling as for a travel
Yeah,
vet is?
Yep, absolutely. So all vets go through the same schooling because we have to take the same boards, pass the same exams, but then you can kind of specialize those last few years of vet school as what you want to do. So yeah, the traveling vets do the same schooling that we do, absolutely. Yep.
Have you ever cried because of an animal?
Oh yeah. I don't think a week goes by that I probably don't cry because of an animal. It's, you know, because it's hard. Especially, I've worked at the same clinic for 4 years now. So I've developed relationships with these pets, with these people. And so seeing people, you know, lose their pets, you know, it's hard, even though, you know, it's the right thing to do. Or, you know, I'll be honest, I go home and worry at night sometimes, did I do enough for that patient today? Was there something I could have done better, something I could have done differently? So, you know, my mind is kind of always turning around it. It's gotten a little bit better as I've worked a little bit longer, but oh yeah, I have definitely cried in the room with an owner while we're putting their pet to sleep, just because, you know, it's hard on us too to watch that pet go sometimes. Absolutely. So that brings in, there's definitely a huge emotional component to being a veterinarian. It's not very well known, but veterinarians actually have one of the highest suicide rates of any profession out there, just because of things like that and the demand and working with the general public. So one thing I always like to just throw out as my little PSA, be nice to your vet when you go in there, because I can't tell you how many times I've had to put a dog to sleep and in 5 minutes I'm in an exam room seeing somebody with their new puppy. And so making that emotional transition can be really, really hard. I know people get frustrated sometimes when we run behind, or maybe we're not as peppy as we once were, but you never know what we just had to deal with 5 minutes ago. Maybe we were, you know, putting a dog to sleep or had our hands on a dog that was bleeding out from being hit by a car. So just, and in any profession, anywhere you go, give people grace, because you don't know what people are dealing with. I think, I see a hand over here. No? Yes, sir.
So you said you're open from 8 to 6, but like say there's a bad emergency with it.
Yeah.
Like, is there any way they could get their dog in? You know?
No, they would have to go to the emergency clinic in Roanoke. So that's part of why I chose just general practice, because I wanted those hours of just 8 to 6. I didn't want to be on call when I went home. I didn't want to have to work on the weekends. There are clinics that have after hours urgent cares. My clinic's just not one. So we recommend people going over to Roanoke to the emergency vet for things like that.
So you're off for 3 days, right?
Yeah, so I work 4 10-hour days. So I'm off on the weekends, and I'm always off on Wednesdays, because I still work a 40-hour week, but my days are just longer. Yeah, and I like that for me, because like I said, I can make doctor's appointments and always know I have Wednesdays available. I don't have to take time off work to do things like that. So not every vet clinic is like that, but a lot of them tend to do that model where it's 4 10-hour days.
For vet techs, like what's
Yeah.
the school? Like what do they? I'm trying to think of what I'm trying to say.
Yeah,
Like, it's not the same school.
Right, it's different schooling. So you do have to go to college and take some prerequisite courses like biology and things like that. I don't think it's as many as if you're applying to vet school. And then you do go through veterinary technician school. They have online programs for that. A lot of the techs that work with me, they did Penn Foster is what it's called. And they did their classes online while they were working in the vet clinic at the same time. So they were earning some money, getting some experience and taking classes online. There's also an in-person veterinary school. I think it's up in Blue Ridge. I think it's Blue Ridge Community College. Don't quote me on that, but it's something like that. And it's 2 years. It's a 2-year program instead of a 4-year program. So there is an in-person option as well. Yeah, but there is schooling, just not as much.
How do you deal with aggressive animals?
It depends on how aggressive they are. Some of them, we just need to give them medications before they come into the clinic that they take probably 2 or 3 hours at home, just as a calming medication, and we're able to do what we need to do. There are some dogs that come in, even with those medications, they're still so aggressive. Sometimes we have to fully sedate them to do what we need to do. It's all reversible sedation. We'll give them a shot. They'll go to sleep for a little bit. We'll do what we need to do and then wake them back up. But that's definitely something that we contend with. Definitely a risk of getting bitten. I've been bitten before. Actually more of a risk of getting bitten by cats, to be honest, because cats are just more so angry at the vet's office than dogs are. I've been bitten and scratched more by cats than by dogs. Another interesting fact is that all veterinarians are vaccinated for rabies. So I have my rabies vaccine because in case I get bit by something, I'm a little bit more protected. So that's a requirement for vet school. You have to get vaccinated for rabies.
What are the most common diseases animals get?
In general practice, the most common things I see on a day-to-day basis, I see a lot of skin issues, a lot of ear infections, a lot of allergy issues, urinary tract infections would probably be the most common things I see. We also see on the other spectrum a lot of vomiting and diarrhea. Dogs love to eat things that they're not supposed to, so they keep us in business with vomiting and diarrhea. So while it may not always be glorious, we see a lot of that too.
So I used to have a cat that had like diabetes.
Uh-huh,
Is it
yeah.
the same like for humans?
It is. Yep, it's the same thing. So she probably was, or he was on insulin injections and everything like that. The blood sugar numbers are a little bit different. So for a diabetic dog or something, a dog's normal glucose is like 100. We call them diabetic when they get like 300-400. I don't know what that is in people, but so the numbers might be a little bit different. But yeah, it's the same thing. They get insulin injections once or twice a day. Have to be regulated that way. Watch what they eat. Same thing. There's a lot of things that cross over between human medicine and veterinary medicine. There's drugs that are similar, just used in different ways. A lot of the same diseases we get as people, animals can get too. So there is a lot of crossover, which is very interesting. Yeah.
So do you mainly see like cats and dogs?
Yep, I only see cats and dogs. That's my choice. You know, there's vets that see everything, vets that see reptiles and things like that. I don't want to do anything like that, so I just see dogs and cats. Yep.
So like possums or raccoons?
No, sometimes people will try, and we direct them to the Wildlife Center in Roanoke. Somebody brought me a turkey one time. They asked me to come out to the parking lot and look at their turkey. Apparently they thought it had gotten shot. I directed them to the Wildlife Center in Roanoke. I don't treat turkeys. So that was interesting. But
Somebody else ask a question?
I know you guys had to write them.
All right, we're taking notes. Like, if you don't do it, maybe we'll cut it.
Yes, ma'am.
Why would you pick small animal care?
Honestly, the hours are a lot better than large animal. Most large animal vets are on call all the time. And then just my size and stature, I'm a smaller type person. All these cows and horses and things weigh 2 to 3 times as much as I do. There's a good chance that I would get hurt. And also I just enjoy dogs and cats more than cows, no offense to anybody. But yeah, I did not enjoy palpating cows and the aspects that came with it. But the big thing was the hours. I didn't like the on-call hours that came with it.
So if you're doing like you're going out,
Mhm.
like let's just say large, like
Yeah.
if you're just doing equine, do you have to have veterinary, like you can't.
Yeah, you have to have a veterinary license and be certified and everything like that. You can't just decide to go do it.
Well,
Yeah.
no, I'm talking about like you can't Is it just one person that goes out?
It depends on the clinic. So the clinic here in town, I don't know if you guys know Pell, they do large animal stuff. A lot of times when they come out, it is just one vet by themselves. But I know there are clinics where it's a vet and an LVT that always go out together. So it kind of just depends on the clinic, and you could pick that based on what you felt comfortable with. But yeah, I know there are some that just go by themselves, but some always have somebody with them too. So it kind of just depends. Yes, ma'am.
What's your least favorite part about being a veterinarian?
Yeah, that's a good question. My least favorite part, I know people think it's probably euthanasia, but that's not always the case. A lot of times my least favorite part is when I have a pet in front of me and I know what's wrong with them and I know what I could do to fix it. But for whatever reason, the owner can't do that, whether that's money, whether that's they don't want to, whether that's, you know, something else. Knowing that I could help that animal, but there's something outside factor preventing me from doing that is tough, because I got into this field to help animals, and so sometimes making those hard decisions of we can't do anything is really, really challenging. So sometimes, you know, that barrier is hard to overcome sometimes. Sometimes the most frustrating part is communication. You know, you tell this person, oh, your dog has an infection, it needs this antibiotic twice a day and then it'll get better. And then they call you back 3 days later, my dog's not doing any better. Did you give the medication? No, I didn't give it. Well, how is it going to get better if you don't? So sometimes that's frustrating too, just that communication barrier sometimes is a little bit tough. Don't get me wrong, euthanasias aren't easy, but sometimes that's the only best thing you can do for the patient, and it's the right thing to do. So there was a hand I saw flying around over here, I think. Either one of you, I don't care.
What's a rough paycheck for you?
A rough paycheck? So I get paid the same thing every 2 weeks. I'm on salary, so I make what I make regardless of how many patients I see and everything like that. So I get paid the same every 2 weeks. There are vets that work on commission and their salary is based on how much they bring in. I don't know sort of what they would average, but for me, I don't have a rough paycheck because I get paid the same thing every 2 weeks, which is what I wanted. I wanted that security. So, I mean, you know, starting salary for vets in this area is about $80,000 to $90,000 a year, and you can work your way up from that. But you know, that is about the average starting salary for vets in this area, just because it's a little bit more rural area. I know up in Northern Virginia, starting salaries up there are over $100,000, but cost of living is higher and things like that too. So. Mm-hmm.
You said when you were in school, like they didn't care if you were sick, like if you had to come in, you had to come in.
Yeah.
Do you still go in when you're sick? Like.
Yeah, I still go into work when I'm sick, if I'm being honest. Unless I'm like deathly ill, I wouldn't go in. But you know, if I have a headache or yeah, I'm pretty stubborn that way too. Though I'm gonna go if I'm sick. But if you had some outstanding illness and you were in the hospital for some reason, they would work with you on that. So I don't mean to be like there's no exceptions whatsoever. But if you know, oh, I wake up and I don't feel like going this morning, they're not gonna take something like that. Yeah.
Which animal do you like more, dogs or cats?
I like working with dogs more than cats. Just cats don't like being with, but I like cats, and don't get me wrong there, but I like working with dogs a little bit more.
How was during the pandemic?
Yeah, during the pandemic, it was very interesting. It was weird. It was challenging because we weren't allowing owners to come into the building with their pets, trying to limit that exposure. So people would park in the parking lot. They would call us, hey, I'm here with Fluffy. My assistant would go out, get Fluffy, bring him in the exam room. I would do what I needed to do, and then I would have to call the owner on the phone to talk to him about what was going on. I never saw the owner half the times, which was weird because you're not getting that face-to-face interaction. They have no idea who I am. And a lot of dogs didn't like it because a lot of dogs don't like to be away from their owner, and they acted more anxious and upset without them. So it was really challenging during the pandemic. We called it curbside service, and I hated it, and I hope we never have to do it again. It was very challenging, very different.
I'm sure like during the pandemic you had to put animals out.
I did. Yes. That was the one exception. We let the owner come in because I don't believe you should keep people away from their pets when they're putting them to sleep. So yeah, we did let people be with them for that.
If you're doing general, you know how you only specialize in dogs, cats.
Yeah.
If you do general, can you do more than that?
You could.
Like rabbits?
Yeah, absolutely. One of my associates who I work with, she does rabbits, and so that was her choice. She does dogs, cats, and rabbits. She just wanted to do that. I don't have a desire to do rabbits, so that was my choice. But yeah, you could choose to do any number of animals. If you wanted to do dogs, cats, and reptiles, you could do that. You can kind of make it what you want it to be. Absolutely.
What was the hardest part of vet school?
The hardest part of vet school was the time commitment, to be honest with you, and the amount of information that they throw at you. Like I said, you're there from 8 to 5, taking probably 6 or 7 different lectures about different things a day. They're throwing a lot of information at you really, really fast that you have to keep up with, and then you're there the next day. So during the week, there's not a lot of free time to go out and do things and whatnot. Even on the weekends, you spend a lot of time studying. So the time commitment was really, really challenging.
How did you maintain, your relationships at vet school?
Yeah, it was challenging. So college is a little bit easier because in college, a lot of times you get to pick the classes you want to take at what time, so you can kind of set up your schedule and you don't have to take as many classes a semester. So college was a lot easier. Vet school, there's definitely that learning curve to it. You have to find the right balance of, you can't study all the time and be in school all the time. So a lot of times for me, I would, go to school, I would come home and I would take a few hours to take a break and, go to dinner, this or that, and then spend some time at night studying. And same thing on the weekends. I'd be like, okay, today I went to Virginia Tech, I love football, I'd go to the football game or, something like that. So just kind of finding that right balance of, you do have to study a little bit, but you can't, you're right, let it overtake your life because you have friends, you have families, you have relationships you want to maintain. So it's a learning curve at first, but I was able to do it and still enjoy myself, have fun, maintain those relationships, and do well in vet school at the same time. So it's just kind of figuring out the balance that works best for you, but it is possible. Like I said, I love Virginia Tech football, even though they're not very good right now. But I went to every football game while I was in vet school, so it's still possible.
What if you're, if you want to, like equine, specialize
Yeah.
in one thing, you only go to school for that one thing?
No, you have to study everything. So even if you want to do just equine, you do have to learn the basics of dogs, cats, cows, because your 4th year of vet school, you have to take the national boards. Everyone has to take an exam to get licensed as a veterinarian, so that way they know you at least know the basics of each species. So that's what those first 2 years of vet school, you're kind of learning a little bit about everything, and then you can specialize a little bit more later on. So you do have to learn everything. I had to learn horses and cows and sheep and pigs. I don't remember very much of it because I don't use it on a day-to-day basis, but you have to pass that test that every veterinarian has to take to be licensed. So.
What about like a zoo vet? How do they go about it?
Yeah, so a zoo vet, zoo vets are really, really hard to get into because there's not a ton of zoos out there. But they would track that public corporate track that I was mentioning a little bit earlier, where they would have a little bit more flexibility in their schedule to take those classes that would focus on zoo medicine. And then a lot of times during that 4th year of vet school, they would find different zoos that would mentor them for 3 weeks or so, and they would spend their time doing that versus in the clinic like we were, just because their schedule was a little bit more open. So a lot of times they would track that public corporate because they had more flexibility with their schedule. But it is hard to get in zoo medicine. You have to find somebody who will mentor you really and get in with them and follow along. It's definitely doable. It would be really cool, but it is challenging.
What is the most bizarre, case you've seen?
So some of those I'll show you guys in the PowerPoint that are a little bit bizarre, but dogs like to eat really weird things and they keep you on your toes with that. I've done many foreign body surgeries and you never know what you're going to pull out of a dog. I had one a few years ago that ate like a pair of underwear. The owner thought it was going to be sock and it was a pair of underwear. That was interesting. I got a few other on here that I'll show you guys in a few minutes when we go to that. But yeah, we see some weird things that dogs eat. It's funny. And a cat. I don't have this on the x-ray, I should have, but we had a cat a few weeks ago. We took an x-ray and it was all this metal in its intestines. We were like, what is this? That cat ate 23 nickels. Don't know why. Cats don't really eat, nickels. 23 of them. That was weird. Never seen anything like that. Cat, it was weird. Yeah, I don't have that x-ray on here. Maybe I'll have it next semester, but that one was weird. Yep.
What's the biggest dog breed that you've ever?
So we have some Great Danes that are pretty big, that are about 150 pounds or so. I would say those are some of my biggest ones, are Great Danes. They're some of the biggest patients I've got. Got 150-pound Great Danes and 5-pound Chihuahuas, so it's quite the range.
you say about grading?
Oh, she was asking the biggest dog that we typically have. Typically. Yeah.
What's your favorite breed to work with, like of dogs?
My favorite breed of dog, I really like labs, golden retrievers. A lot of them, they're just happy in general, so they're happy to be there. You don't really meet mean labs or golden retrievers very often. Those are some of my favorites, probably.
What's one of the most common, like, I'll say things that happen to like a dog when they start aging, like?
Yeah, most common things, it depends on the dog. So small breed dogs, you're looking at heart failure. A lot of them get heart disease. Larger breed dogs, typically you're looking at cancer, to be honest with you. Certain types of cancers are the most common.
What's your favorite part of your job?
My favorite part of my job is just the variety. Like I said, I walk in every day and it's different. Like I don't have the same mundane routine every day. Some days I get to do surgery. Some days I'm seeing, just a lot of wellness things. Some days it's more sick things. So the variety that every day is different, it keeps me on my toes. And, working with the general public is a lot of fun too, because, people say funny things and people are really, it's great to meet all these different people and learn their personalities and their pets. So it's fun working with and seeing a lot of different people throughout the day too. So that's really fun.
Do you prefer working with large dogs or like small?
I actually would prefer working with a little bit larger of dogs. This is just so cliche, but a lot of the smaller dogs are the ones that want to tear you up and eat you, like the Chihuahuas and the Shih Tzus. A lot of them are really mean. Not that all of them are, but the larger breed dogs tend to be easier to handle sometimes. But I have great, small breed patients too. Yeah.
What's your worst injury that you?
Luckily, knock on wood, I have not gotten too hurt. I've just gotten bit a few times on the hands is the most common because you're looking in the dog's mouth and they'll kind of get you on the hand a little bit. I've gotten scratched, by cats and things, but luckily, knock on wood, I haven't had too bad of injuries. None of my staff really have. We learn how to read these animals to hold them appropriately and safely, learn the signs of when they're gonna lose their minutes and start becoming aggressive. So we kind of know the safe ways of handling them. Sometimes they take us by surprise, but luckily, knock on wood, none of us really get too hurt. That's small animal medicine. Large animal medicine, I'm sure people get kicked by cows and horses all the time, which is what I was scared of and why I didn't want to do that. But I'm sure you could probably get a little bit more hurt doing that, to be honest with you. Yep.
Do you have time to have a dog?
Yeah, I have time to have a dog.
So you do have a dog?
Yep.
No, because she's always in the office.
Yeah, not always. I mean, I'm there from 8 to 6, 4 days a week. Yeah, I have a dog. She's fine.
How does it get taken out at lunch?
She doesn't get taken out at lunch, but
That's how.
Just my question.
I mean, most dogs can hold, she's an adult, she can hold it for the day. And,
What kind of dog?
she's a boxer mix.
What's your least favorite dog breed to work with?
I always make people mad when I say this, but my least favorite dog breeds are a lot of times, German Shepherds. Yeah, sorry. We just meet more of them that are mean than are not. I have great German Shepherd patients that are fantastic, but a lot of times I see German Shepherd on my schedule and I cringe because I'm like, this is going to be a fight. It's a stereotype.
Require anybody to come in with a muzzle?
Oh yeah. Oh yeah. A lot of times we have alerts on the chart, muzzle patient, or does better away from owner, or will need sedation to kind of warn us. Yeah. Some pets do better away from their owner because they're trying to protect you. So some dogs are really protective of their owner and they're more aggressive if you're with them. Not all the time, but some of them are trying to protect their owner because they think we're gonna hurt them. So some dogs do better away.
Who does like the police canines?
I do. Yep. We actually do it, Franklin County. We do the animal shelter up here on the road. We take care of their pets and the police dogs. We do that.
Now, is there a certain training you have to do with the police dogs?
No, typically their handlers will know them really, really well. The police handlers know them well, and they'll come in and they'll hold them for us. Some of them are fine. Some of them are just drug sniffing dogs, and they're not going to be aggressive towards people. But some of them are, and they'll come in muzzled, and the handler knows that, and so they're really good about helping us with them.
Those on 220 yesterday.
Yeah. I once had a police dog, actually. I'd been working there like 6 months maybe, and they were in this building chasing perp or something like that, and the floor gave out from under him, and he fell like 3 or 4 stories down. Luckily, the dog had his vest on, and he was totally fine, but they rushed him right in, and it's amazing. His adrenaline must have been going so much he didn't get hurt. But yeah, that was one of the craziest police dogs things I've seen. He fell like 3 stories through a wood floor, chasing somebody.
And you broke on floors? Or like...
Yeah, I think the floor gave out because it was old, and he probably just stepped on it the right way, and it gave out from underneath him. Yeah.
Do you ever work like on dogs that are kind of breeded, you know, wrong, like a pug, you know, you ever?
Yeah.
Like,
Oh yeah. Yeah. We see a lot of the brachiocephalic dogs, like pugs, bulldogs, that have just been bred genetically. They can't breathe. Their noses are too small and their palates are too long, and so we do surgery to open up their nasal passages a little bit, and we remove that excess soft palate. So yeah, that is something we do pretty commonly, just because of the nature of the breed.
We have about 30 minutes left, and I only have a few of mine asking questions, but do you want to?
I say, yeah, I wasn't sure what time it was. We'll go through this, and if you think of more questions at the end, we can do that too. So these are x-rays of things that I've seen. These are real life cases I saw at Franklin County Animal Hospital down the road throughout my 4 years. So I've kind of got it broke down into sections. So the first section I like to call is, what did this dog eat? So I'll let you guys kind of see if you see anything wrong with these x-rays, if you want to guess what's going on. The first one's really easy, so I started you off with something easy. What did this dog eat? Somebody said a battery, and somebody is correct. This dog ate just a AA battery. So the owner saw the dog eat the battery, brought it right to us. We took the x-ray. It's still in this dog's stomach, so that battery is in the stomach. We'd made this dog vomit. The dog vomited the battery up and went home and happy as can be. So, you know, easy case scenario. The owner saw him eat it, brought it to us. We made the dog vomit. It went home. It was happy.
How do you make the dog vomit?
So there's I always get that question. There's a drug that's called apomorphine, and we give it in the vein in their leg, and it induces vomiting within 2 or 3 minutes, and it's fantastic. I've had to use it on my parents' dog twice. It works great. Yeah, you can use hydrogen peroxide. We don't use that in the clinic. It's not as quick acting, but yeah.
How do you make them stop?
So then there's a medication that's called Cerenia. It's an anti-nausea medication we give them, and it stops the vomiting. So yeah, they get a shot to make them vomit. About 5 minutes later, they get another shot to make them stop vomiting. It's funny sometimes. Alrighty, this one's harder. So I started you guys off easy. This one's a little bit harder.
Where is it?
Does anybody see anything? First of all, I know this one's kind of challenging. Yeah, I don't know if this arrow shows up, but it's right here. That's weird. So that shouldn't be there. That's actually stuck in the dog's intestines. It's moved out of the stomach. It's in the intestines. So that shape is weird. Does anybody have any guesses of what it might be since I pointed it out? What? No, it's not an infection. No, it doesn't start with an R. I know what you're thinking. That's what I thought it was too when the dog first came in. You probably think it's a razor. So it was actually, that's where it is. I forgot I did the arrows. It was part of a Kong toy. The dog had chewed off just that top part of those Kong toys, and it got stuck in there. This was like a 7-month-old lab puppy. It had gotten stuck. So this one we actually had to take to surgery. We had to cut the intestines, get that toy out. But she did great. She went home the next day. She was totally fine. But yeah, that had gotten stuck in there. Yeah.
If you remember, how did the owner know that happened? Like,
So a lot of times when dogs have something stuck in their intestines, they vomit a lot. So this dog probably vomited 8 or 9 times in one day, and that's very suspicious if they're vomiting that much in a short period of time, that something's stuck in there. And especially a young lab, I mean, they eat all sorts of stuff. So yeah, the owner was like, oh yeah, she eats stuff all the time. So
Labs are crazy.
labs are crazy, you are right. All right, how about this one?
Are we looking at that ball?
Yeah.
Which ball?
Oh, sorry, I didn't realize that was all connected. Yeah, this dog ate rocks.
Oh my God.
I don't know why. One was stuck in the stomach and one was stuck in the intestines. So this dog also had surgery, same thing, but he did great too, no problem.
What's the, like,
Yeah. So it's part of its vertebrae up there. I think is probably what you're, under the spine, that's part of it, the lungs. Yeah, so you're getting a little bit of lung field in that one, that black, and then the white inside of it is part of the lungs. Yeah. All right, how about this? This is a weird one. That's what I thought.
What the legs are.
Yeah, I think hopefully this will. So that's what we're looking at.
Is it a ring?
No? So this dog, I've been out of school about a year. This is one of the weirdest cases I've ever seen. It was like a little Cavalier Spaniel type dog. She was probably 10 pounds or so. Once again, the owner brought in vomiting a lot, vomiting some blood. So we took this x-ray and I thought what a few of you guys thought, oh, it looks like an earring or a ring or something like that. But since she'd been vomiting so much, we ended up taking this dog to surgery. So we did surgery and I went in there and I was able to like scoop my finger around what it was. And I was surprised at what I pulled out. So this is what I pulled out. This is what it actually was, the actual thing. It's hard to tell, but this is a penny that the dog had eaten, and stomach acid had eroded that penny to that's all that's left is like Lincoln's little head there. So this was a penny that I pulled out of this dog that the stomach acid had eroded because it had been in there so long. So the problem with this is that, little known fact, pennies are toxic to dogs. Pennies are made out of zinc. Zinc is toxic to dogs. So this penny had been in there so long and it had eroded so much that that's what was making this dog really, really sick, was zinc poisoning in her veins, and that's why she was vomiting blood. This is a sad one because unfortunately she didn't make it because that penny had been in there way too long. So it's an interesting case. It's something that people don't always know pennies are toxic to dogs, and it was quite the surprise when I pulled that out. I looked at my technician and I was like, uh-oh, we have a bigger problem. So that was kind of an interesting one.
Now, what would y'all have done for the dog if it stayed alive to get like the zinc out of it?
Yeah, so really there's not like an antidote for zinc. What we did, and she did make it through the surgery, we put her on IV fluids to try to flush it out of her system, but unfortunately it had just been in there too long, and she was really anemic too because it attacks the red blood cells, and so she needed a blood transfusion, and none of the things went well for her. Had that penny been whole, she probably would have been fine and we would have been able to flush it out of her system, but because it had been in there so long, it was just too much for her body. And she was only 10 pounds versus if you had a 50-pound lab that ate a penny, they're gonna be fine because they're just a bigger dog, so her size didn't help her either. Yeah.
Is it just pennies or is it all?
It's really just pennies. I mean, it's not great if they eat quarters and nickels and things like that. You still don't want those to be in there because they can get stuck, like what happened with that cat I mentioned earlier. But those don't have zinc and those aren't toxic like pennies are. Pennies are the big problem. Yeah.
Is it about harm for humans?
I don't know, but I wouldn't recommend eating a penny. I'm not sure. I'm not a human doctor. How about this one? I think this is the last one that I have of what did this dog eat. Yeah. Someone said it. So that's where it is in case you're not able to pick up. It was a walnut. That's not a great picture. This dog had eaten a walnut that just happened to get stuck. You know, it's just a freak thing that happens because once again, you could have a bigger dog that eats a walnut and it's fine, but the smaller dogs, their intestines aren't as big, it's gonna get stuck a little bit more easy. So this dog had eaten a walnut. So we'll kind of get away from GI stuff and we'll go into like musculoskeletal. So a common thing that we see in dogs nowadays, especially big breed dogs like labs, shepherds, things like that, is they'll tear their cruciate or their ACL ligament. If any of you guys play sports or like football or anything like that, it's the same thing that football players can do. They'll tear the ligament in their knee. So they need surgery to fix that. So this is just an example of a dog that tore its cruciate ligament and had surgery to repair it. They have to change those bones and kind of put that implant in. This is also an example of a type of surgery I do not do. So as a general practice vet, we're not qualified to do that. So we would have to send that dog to a specialized orthopedic surgeon for something like this. So I just like to show the x-ray because it's a common thing that dogs tend to do nowadays. I also mentioned to you guys earlier that we see a lot of hit by cars. So that's one of the most common emergencies I see. So this dog got hit by a car. If anybody sees anything wrong with this x-ray. It's back, yep.
It's leg.
And its leg, yep, you guys are right. So right there where the arrow is, it's back, it broke its back. And then right here, it broke like the end of its femur right there.
How do you fix that, like surgery?
So this is the same dog, just a different picture of the broken back. Unfortunately, in this case, with a broken back, there's not much you can do to fix it because the spinal cord was severed and the dog was paralyzed from the waist down. It couldn't feel its back legs, couldn't use them. So unfortunately, this dog the owner elected to put it to sleep just because of no quality of life. If it was just the broken leg, we could, put that in a cast and things like that, but the back made this one a little bit more of a challenge.
I've seen, like, granted, yeah, there's back and the front, but they put them in like a special
Yeah,
chair.
and that's where it kind of depends on the owner and how much they're willing and want to do for that pet. So that's where it kind of comes down to an individual decision for each person. There's no right or wrong answer. If that owner had wanted to pursue that, we could have, but this dog was older, they didn't think it would do well. There's a lot of factors that went into that.
How come the vertebrae like vary so much from,
Yeah, so that's the conformation of this dog. So this was a smaller, I think it was like a Australian Shepherd type mini dog. And so its vertebrae are a lot more shorter and closer together just because of the conformation of the dog. So if you took an x-ray like of a pug versus an x-ray of a Shepherd, the pug's vertebrae are gonna be all tight together because they're all hunched over. They have terrible conformation. Versus a Shepherd is gonna have nice spacing between the vertebrae just because they're bigger and longer. So really it's just the conformation of that animal being different than a cat or another dog or something like that. So every animal x-ray is a little bit different just because of the shape of the dog or the cat.
What's that?
Do what? Yeah, it was his collar, yeah. So this is a dog that also got hit by a car, but I think it just ran over its foot and it just broke its toe right there, if you see that. This is an easy fix. You just put a splint on them, just like you would a person, kind of splint those toes back, and the body will heal itself up. Had a little bit of arthritis, but do great. How about this one?
His elbow.
Yep.
Is it dislocated?
His elbow is dislocated. So if you see right there, so that's a normal elbow. That's what it should look like, and that's what his looked like. They also suspect had gotten hit by a car, dislocated that elbow. So we just sedated him. We were able to pop that back into place, put a cast on him. Did great.
Was there no worry with the tendons being stretched in?
No, there's probably is that worry that it's never really going to heal right, but it's a little bit different than a person because a dog can compensate for that a little bit better because they've got their 3 other legs to distribute that weight to. So there probably is tendon damage, but it's not much we would do about in a dog, to be honest with you, just because they can compensate so well with it. So this is just an example. So a common thing we see in dogs, especially breeds like German Shepherds, is really bad hips, what we call hip dysplasia. So this is a dog that has hip dysplasia, and this is what normal dog hips should look like. So if you see on that one, there is no coverage on the head of those femurs, so femurs are just kind of floating out in space. So this is just an example of a dog with terrible hips, really bad hip dysplasia. Some dogs, we don't do anything about that. They're able to compensate, they live normal, have healthy lives. Some dogs actually get hip replacement surgery, something they would go to Virginia Tech for to fix those hips a little bit.
Don't labs get a lot?
Yeah, labs can get it too. Yep, labs and shepherds. A lot of breeders will check for that in their breeding dogs. This was one that did not pass. So this is pretty bad. This is an example of an older dog's. Dogs can get bone cancer. So this is an example of a bone cancer that has kind of just eaten away at the bone of that dog's radius. And so we see this a lot in older dogs. I actually, growing up, one of my own dogs had bone cancer. So it kind of just depends. You can amputate that leg and try to stop the spread of the cancer, but it's very, very painful for them, and definitely something we have to deal with. So this is a pretty extreme example of a dog with bone cancer. I just like this x-ray. This dog stepped on a nail, obviously. It was a lab. It came in, because it's just a cool x-ray. We pulled the nail out and he was totally fine. I mean.
Did you have to give the dog like a tetanus shot too?
No, we actually don't do that in dogs. We don't give dogs tetanus shots. They're really not very prone to it. If this was a horse, you would give them a tetanus shot because you do that in horses. But in dogs, we don't do that, actually. They don't tend to get tetanus. Yeah. It's just the nature of their metabolism and their body. Their temperatures run a little bit higher. They're just not very prone to it.
How many cats did you get? It was like up in somebody's car when they started.
Not very commonly, but it is something we see every once in a while, especially in the winter. But my aunt had that happen to her.
I'm sure the percentage is higher that they die.
Yeah, I'd say honestly most of them don't do well, yeah. Alrighty, so we'll get away from bones and we'll look at abdomens. So there's something wrong with this dog's abdomen that's a little bit off. Yeah. So that right there is a mass in this dog's abdomen that should not be there. So does anybody have a guess of what organ that might be that's a little bit different?
Liver?
Nope, not liver, not bladder,
Stomach?
not stomach, not kidney. No, spleen. Someone said spleen. Okay. So this dog's spleen is off. So in large breed dogs like labs, shepherds, things like that, we commonly see dogs that have splenic masses. I think I have, so this is, you probably can't see that because of the light. I don't think she said you can turn that light off. So, but that was an example of a normal spleen. Sorry, guys. But anyways, so when we find these masses, we want to remove them because if that mass stays in there and continues to grow and grow and grow, sometimes that mass will rupture. And if that mass ruptures, the dog will bleed out because the spleen is just full of blood. So if we can catch it early enough, like in this dog, we can remove that mass and we can get it out, and the dog typically does great. So on the next slide, if anybody's queasy, don't look at it because I have a picture of an actual spleen that I took out with a mass on it. So I'm preparing you, don't look if you're queasy. So that is the actual spleen of that dog from the previous x-ray that I took out, and the mass is kind of in the center right there. It should not look all necrotic and things like that. So I will flip it. So this is another splenic mass. Obviously this one is a lot bigger than the one that I showed you in the x-ray previously. This would be one that unfortunately tends to be inoperable because it's just so big, it's taking too much of the abdomen up. There's too much of a risk of bleeding, so a lot of times when they're this big, you can try, but typically the surgery doesn't go as well as it did in the previous case. So this one, unfortunately, was inoperable. This dog did not do very well.
So
but
it's not one that you just kind of have to wait?
Yeah, so we talk about it with the owner. A lot of times when they come in, when they're this bad, the dog is not doing well clinically. So this dog came in just kind of laying around lethargic. Its gums were like white in color because it was bleeding from that mass. So this one had gotten so big it was causing a problem. The one in the previous example we caught like incidentally is the lucky catch. But a lot of times you don't know that they're in there because they just grow and grow and grow, and the dog doesn't show any signs until they get this bad and they start rupturing. So then you have a problem. So this one, unfortunately, like I said, didn't do well just because the mass was so big.
So there are no signs, like
Not commonly. You can't pick it up on blood work. There is no test for the spleen on blood work. Sometimes you can feel them on abdominal palpation, but sometimes not. In these dogs that are really obese, sometimes it's hard to feel the organs because there's so much fat in the way. And the dogs act clinically normal. They're their normal, happy selves until this mass ruptures. And then at that point, it's not much you can typically do.
I mean, they don't start being like
No.
closer together.
No, they act totally normal. Yep.
How do you avoid it?
Not really a way you can avoid it, unfortunately. If you have a larger breed dog, like a lab or something like that, and you wanted to be super cautious, you could ask your vet to do like an x-ray once a year just to check and make sure the spleen looks okay. But you can't prevent it. It's a type of cancer, and you just can't prevent it from happening sometimes.
Is there any specific breed that's prone?
I would say labs, boxers, and German shepherds are the three most common I see it in.
Where, I know it's kind of random, but where would a tumor be if it was more on like the bladder?
So the bladder is more back here, and I have a picture of some bladders here in a second. So it's going to be more close to the tail, toward the back end of the dog.
Yeah, I had a dog that had a tumor on his bladder.
Oh, okay. Yep. So this is kind of an anomaly too. This is actually a cat. This is a cat x-ray. This is a cat that we think, once again, got hit by a car. So what happened to this cat is it has what's called a diaphragmatic hernia. So your diaphragm is what separates all your intestines from your heart and your lungs. In this cat, that diaphragm ruptured and all of its intestines are up around its heart. And that's why it looks so congested and junky up there, because really its stomach is right beside of its heart. And so what needs to happen is surgery to put all those organs back where they're supposed to go and to repair that diaphragm. But this is the only case I've seen of that in my 4 years of practice. So it's not something that happens very often, but it was just kind of an anomaly that makes for an interesting x-ray.
How is the cat acting with that?
So this cat was having trouble breathing because all of its organs are pushing its lungs and its heart and everything. So this cat was really having trouble breathing.
And did it survive?
It did. Yep, it did well.
So all the organs got up there.
Yeah.
Like if you just held the cat like
No, they're not just going to fall back down. That's a good try. It would be a lot easier if that happened. So this is actually a bladder. So this is a dog that has an issue with its bladder. It has what's called a bladder stone. See that spiky thing that the arrow is pointing to? That's a bladder stone. So if it was like a tumor, this would be the area that you'd be looking for as well. That's where the bladder lives on x-rays. But this is a dog that had bladder stones. We see a lot of that in dogs and cats in this area because sometimes the drinking water, if you have well water or something like that, has a lot of calcium in it. And so if they have too much calcium that builds up, they'll form these bladder stones. They don't really get kidney stones like people do. They get them in their bladder. So we do surgery and we take them out. This is another dog that just has a lot more. And then once again, if you're queasy, don't look at this next slide. These are some actual bladder stones that I've taken out. Yeah, that one dog had, you know, that whole tray full. And you can see how big they can get too. I mean, that was like the size of a rock. So these are some bladder stones that we've taken out. But yep, that came out of one dog. Yep. It's amazing. It is painful. Yeah, and a lot of times they're urinating blood because the stones are in there. It's definitely painful. Yeah.
Is there any way you can, look up past some of those smaller stones, like on their own?
Yeah, we try. So there's a diet that we put them on. If we find bladder stones, we'll try this diet for a few weeks. We'll see if we can get them to dissolve and pass. If that doesn't work, we take them to surgery. It's actually a really fun surgery. It's one of my favorite surgeries to do. Yeah.
So the big one in the middle and the one on the left, how big was it?
So that big one in the middle was probably like the size of the palm of my hand, probably the size of a rock. It was pretty big.
Are they like hard?
They're hard. Yeah, they're firm. They're calcium deposits, and so they feel like a rock, like if you picked up a rock. Yes, sir.
So are each of those pictures on like?
So that one on your left is from one dog, and then this one is from one dog. So it's two different dogs, but all those stones in that one tray came out of one dog. Yeah.
Do you keep them in the review?
No, I don't keep them. I just take pictures, and sometimes the owners want to keep them, in all honesty. So a lot of times they want. Yeah. So last thing, I don't know if you guys will be able to see this because of the light, but what do you guys see on this x-ray? Babies, yeah. So we do pregnancy x-rays. If you breed your dog, you want to know how many puppies are in there, so that way when they give birth, you know if they're having any problems. Can you guys have any guesses about how many? Three?
Four.
Yeah.
Is it 3 or 4?
There's 4. It's kind of hard with that light, so I apologize, but
I didn't see the one.
there's 4.
What kind of dog?
This was a German Shepherd. And then how about this one? You guys can see. Yeah, there's 2. She only had 2. This was also a German Shepherd. I have a German Shepherd breeder who comes in pretty often and does these on her dogs.
Do y'all not do like live birth?
No, typically most dogs don't need help. They'll give birth on their own. We do C-sections if they are having an issue. I've done a few C-sections where, one of the dogs, their head is too big and they get stuck, so we have to take them in and do a C-section. So we'll do that if they're having issues, but 90% of dogs are able to give birth on their own. They don't really need much help. I think that was all I had. So that's just kind of some of the, basic different things we kind of deal with on a day-to-day basis, a little bit of variety of some of the weirder things I may have seen. Give you just a little idea. Yes, sir?
My cousin's dog gave birth, and 2 of the puppies, like the back half of them didn't develop. It was just like the mid and the front.
Oh, okay.
And then just in half.
Yeah, that's unfortunate. Yeah, that is. That happens sometimes. That's always sad. Yeah. All right. Any last minute questions? I don't know what time it is. Yeah, you guys are about done.
Who I have to ask questions? Chris,
Yes.
Tucker, Ashley, Gianna, Calvin, Nathan, Chance, and Taylor.
Yes, sir.